Hello everyone, I am Dr. Pankaj. I am plastic and cosmetic surgeon. Today I will be talking about the impact of smoking on plastic and cosmetic surgeries. So, first thing is how smoking affects the results of any cosmetic and plastic surgeries. Second, how it differs as compared to other general surgeries. So first, smoking or tobacco in any form, it contains a substance called nicotine. This nicotine is very harmful to our health. This nicotine it acts on the blood vessels at different levels that supplies the tissue, supplies the skin. It causes vasoconstriction of the vessels. So because of that, the blood supply to the skin to particular organ is reduced. So reduced blood flow leads to reduced oxygen level to that organ, and this oxygen is very important for healing of the wound. So overall what it does, it reduces the blood supply, reduces the oxygen, which causes necrosis of the overlying skin, ultimately leading to infection of the wound, gapping of the wound, failure of the surgery. So these are the consequences that of nicotine on the plastic procedures. Second is how this differs in compared to the general surgery. So in plastic surgeries, we deal with each level of tissues, like we deal with the dermis, we deal with subcute tissue, below it the muscle, bone. So the blood vessel at each level will be affected. As against the general surgery, we directly deals with the particular organ. Take an example of appendix, where we directly operate at the level of appendix. We do not deal with the other tissues. So that is the difference. And so the complications are more in plastic and cosmetic procedures. Take an example of abdominoplasty or rhinoplasty or facelift. So the complications will be more, the overlying skin will be completely necrosed, there will be failure of surgery. So it is very important to stop smoking at least 2 to 3 weeks before surgery and 2 to 3 weeks after the surgery, so that the overall complication rates are reduced. Studies has been shown that the complication associated with smoking is almost 50% as compared to around 12 to 13% in the non-smokers. This has been published all over the world. So it is important to stop smoking prior and after the surgery. Also, the anesthesia related complication associated with smoking is also higher. So overall risk is high. Another important thing is why to stop smoking before and after the surgery, as smoking itself has overall impact on general health, like increases the risk of cancer, increases the risk of heart attack, respiratory problems, and n number of problems. So it is always better to quit smoking. So say no to smoking. I hope you like the video. Thank you.